Hi everyone, Dr. Emmy from Pain Free and Fit. Today, for those of you with spondylolisthesis associated with posterior disc herniations in your lower back, we're going to be talking about a great self-treatment exercise that you can do at home or in the gym called hanging spinal mobilizations. Hope you enjoy. Now, keeping in mind our theme of each case of spondylolisthesis is unique and the rehabilitative exercise for any individual has to be tailored to their unique problem, we're going to today talk about a posterior disc situation where the inside of the disc has herniated backwards, and that's confirmed either on MRI with a good clinical diagnosis. The exercise today is going to be a bit different than many of the more typical exercises you'll see for spondylo, including many of the ones we've shared on this channel, because it does not include a posterior pelvic tilt. Remember, those people whose spondylolisthesis has slipped forward in the lower back and their pain is due to the instability of the vertebra slipping forward, and soft tissues, ligaments, joint capsules have been overstretched and irritated with that, they would probably benefit in most cases from some degree of posterior pelvic tilting, because as you posterior pelvic tilt, tuck the tailbone under and raise the pubic bone, that decreases the arch of the spine. It flattens it out a little bit and helps to mechanically pull that vertebra back so it's not as aggravated going forward. That would also be indicated usually, not always, but for those patients with spondylo that have an associated anterior disc herniation, where the inside nucleus of the disc has broken through and moved forward, or anterior, as well as those with problems like facet syndrome, where the joints get compressed in the back, and stenosis. However, for those cases of spondylolisthesis where the pain is mainly due to a posterior disc herniation, meaning that even though the vertebra is slipped forward, the majority of their pain is because the inner disc material, the nucleus, has broken through cracks and tears in the disc and has moved backwards. Those individuals usually, not always, but usually will benefit from the opposite. They'll benefit from some type of anterior pelvic tilting, where we're actually going to increase the arch of the back. Now you may say, won't that drive my vertebra forward? If your vertebra is stable, it will not drive it more forward, but what it will do is it will compress the back portion of the disc where the disc nucleus fluid has moved to, and that pressure in the back will help to squeeze and assist that nuclear material to move more back to the center, thus relieving the pressure on the back of the spine. Now, how do we do this? Because many times with spondylo, if we increase the arch of the back, either by raising the tailbone or leaning the upper body backwards, you're going to aggravate pain. And if you know from all of our videos and all my online instruction, we never want to irritate pain with any of our rehabilitative exercises. So the key to this is we first have to open up the back portion before we extend it or arch it or compress it. And we can do this several ways. We can do this standing by simply tilting our tailbone under, posterior pelvic tilting, to a comfortable range of motion for 10 to 20 repetitions or a few sets of 10, so that we open up the back of the spine. When we do that first, many times afterwards, we can have a little bit of extension moving back. However, there's a better way to do that, and that's using a decompressive exercise where we actually hang or suspend the body to create what's known as a long axis traction, where the spine is going to be vertically lengthened and the inside of the disc is actually going to be created into a vacuum state, where it's going to help that fluid to move from the back of the disc towards the front. Let's take a close-up look and see exactly how we're going to do that. So to create a stretch or long axis distraction on the disc, which is going to create a slight vacuum in the disc, we can use either dip bars, where we hold and we bring our bodies up so we're hanging, or even so that as we come up, our heels come up, but our forefeet are down. Another option is to do this against a counter, where we can put our hands on the counter, but the idea is you're trying to stretch the spine out by dropping the pelvis away from the shoulders as you hold your upper body weight with your arms. In this position, we're going to explore an anterior pelvic tilt, where I'm lowering my pubic bone and raising my tailbone. Now you're going to use a range of motion initially. That's a comfortable range of motion. So as my spine is being stretched out because my lower body is pulling away from my shoulders, I go up, hold for 2 or 3 seconds, and then back down to a neutral position. Again, back and hold. What this is doing is, as the spine is being stretched and a vacuum is created in the disc, as I raise my tailbone and lower my pubic bone, I'm compressing the back portion of my disc, which is pushing that nuclear material or herniated material
back towards the center of the disc. If I use a range of motion of extension, meaning I'm arching my back by raising my tailbone that's too painful, I may have to start with first going the opposite direction, doing some posterior pelvic tilts, tail under, flattening the lower back. After a set of 10 to 20 repetitions of that, I may then be able to have a greater range of motion going back into extension using the anterior pelvic tilt. If I have a disc herniation that's off to one side, let's say my disc herniation is not going straight back but off to the right side, for an example, I'm going to want to compress that right side to drive the material of the disc back to the center, from the right towards the center. So here, as opposed to anterior pelvic tilting straight back, I'm going to raise my tailbone back and to the right side. So my right hip is coming slightly up and my left hip is coming down with the motion. In this way, as the spine is being distracted, there's both an extension or backwards bend and a sideways compression that's targeting that disc herniation and helping to move that disc material back to the center and easing disc pressure associated with spondylolisthesis.
If you've enjoyed this video on spondylolisthesis healing exercises for posterior disc herniation, feel free to subscribe to our channel. We got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great way to figure out what your body mechanics are, what your posture, movement, spinal stability, muscle imbalance issues are that are contributing to your spondylolisthesis pain, and then how to build a program around that to help rehab your spondylolisthesis so you can get active without pain again, check out our spondylolisthesis fast track program available at painfreeandfit.com. I hope this video on spondylolisthesis and posterior disc herniation helps you with your chronic low back pain.